Hi, I'm Olivia Shasho, and I'm going to be showing you the central line venous dressing change. So before we start that, we would do our 6 steps. We're going to check physician's order for a dressing change, wash our hands, introduce myself to the patient, and explain the procedure. We're going to identify the patient using the wristband and asking them to give us their name and date of birth, checking it against it, and providing privacy, and I have my equipment all ready. So I'm going to come into the patient's room, say, hello, I'm Olivia, your student nurse. We're going to be doing the central line dressing. Ask the patient about pain. They have 1 out of 10, so I'm not going to be giving them pain meds. It shouldn't be a very painful procedure. I'm also going to explain to the patient that it's of the utmost importance that when we do this dressing change that there's no contamination. Explain to them don't touch anything on the sterile field or anything, and to even have their head turned away from the dressing site so as not to breathe on it, and that I will be wearing a mask to prevent any sort of contamination. So we're going to look at the site, expose that, and then I've already washed my hands. So I'm gonna put my clean gloves on, and we're gonna open up the central line dressing tray. Okay. I'm going to open the first tab away from us. And so we're going to now put the mask on ourselves. There we go. Okay, and we're going to now remove the old dressing. So normally on a real patient, it's going to be a little bit easier, and that's, these mannequins are very sticky, so you just always want to make sure you hold the lines up here, never press on the actual line, and then you're going to pull away like so. Okay, so we're going to dispose of that, and also our clean gloves. The garbage over there, and I'm going to remove my sterile gloves over here, and we're going to continue opening up the central line. Okay. I have my garbage right over there. Be careful with the central, the sterile area. You can only touch the 1-inch border or underneath. So we have all that. I'm going to wash my hands. I have Purell. So I've Purelled. We're going to, keeping the sterile field in our line of sight, I'm going to put my sterile gloves on so we can continue. So carefully putting these on. Okay. Now I can use this hand to touch the inside of that glove. Okay. Okay. And then we can come back to that hand and sort everything out. We're going to grab from the inside and drop it in our trash. Okay, so now I have my sterile gloves, I have my sterile field, and we're going to begin. So first thing, it looks like there's some, I want to use my alcohol swab sticks because it looks like it could use some extra cleaning. So probably just one. So I'm gonna actually dispose of the rest of them. So yeah, just to get under here, between the lines, just make sure it's really very clean, okay? So now, as you've seen, this hand has touched the patient. Okay, so this hand is still jet sterile. I'm gonna take this. We're going to crack it. And this is important, it's the friction. We want to do vertical cleaning using lots of friction and horizontal as well, because the friction is really what gets it clean, okay? So we've cleaned that. And now we're gonna we're gonna let it dry. Don't fan it or blow on it. It'll dry quick enough. And we're going to take our central line dressing and we're going to open it. Let's see, it's just about dry. So it opens up like so. And we're going to lay it on right like so, making sure. Okay. Pat it down, and then we can easily remove this top piece. Okay, so now we have our sterile dressing on. Last thing to be done, we're gonna be putting on our little sticker. It's gonna have the time, date, and my initials of when this was changed. Then this is all, we can dispose of all that. Carefully remove the gloves. And this would go in the garbage. We're gonna make sure the patient is okay. How's your pain? We're going to raise the side rail and lower the patient down. We'll also be recording everything in the notes that we did the dressing change, how the patient tolerated it and everything. I'm going to leave the patient in a comfortable position with the bed all the way at the lowest position and with the call bell. Then I'm going to wash my hands and continue on with my day. Thank you.